Today we will talk about vitamin D. Now it is recommended to drink absolutely everyone and always. They say that you need to drink it constantly. Let's find out if vitamin D is really so important and whether it is worth drinking it all the time. Vitamin D is a fat-soluble vitamin. Vitamin D is found in fatty fish, caviar, egg yolk. Some vitamin D is found in dairy products, but not everyone consumes them. Vitamin D is also found in some seeds and oysters. Vitamin D can accumulate in our body. By the way, all fat-soluble vitamins can accumulate in our adipose tissue. Therefore, when you lose weight, the amount of these vitamins can decrease. Vitamin D can also be produced in our body from cholesterol. Note: if you leave the house at lunchtime and stay under the sun for only half an hour, then vitamin D will be produced from your cholesterol. No matter what climate you are in, only the sun matters. But not all people walk under the sun at noon. Because at this time the sun is at its brightest and it is not safe. Why is vitamin D so useful? Vitamin D helps to absorb calcium, phosphorus, electrolytes and micro and macro elements in our body. It's important. That is why I recommend giving vitamin D to children in order to avoid the appearance of such a diagnosis as rickets. Therefore, vitamin D is very important for our bones. As a consequence, vitamin D is important for our teeth and gums and is the foundation of our immune system. With low levels of vitamin D, our immunity also weakens. By the way, with coronavirus, as you often noticed, almost all patients were prescribed to take vitamin D in order to strengthen the immune system. Why is vitamin D deficiency dangerous? Of course, it is dangerous for bones and teeth. Scientists are increasingly saying that with a weak immune system, with vitamin D deficiency, we are more prone to viral and cardiovascular diseases. Should you take vitamin D regularly? I think you should get your vitamin D levels tested. Any lab can do this. If your vitamin D level is below the average reference value, then you should take it. At first, you should take 10,000 units and 15,000 units to replenish the level. And then, when the vitamin D value exceeds the average reference level, you can switch to a maintenance dose, that is, take 5,000 units for 2 months. If your level of vitamin D is all right and it is above the reference value, you just need to be under the sun in the afternoon, take a walk. The main thing is to protect your head and smear your face, cover it with sunscreen in order to still maintain youth. How does an overdose of vitamin D manifest itself? The main symptoms are lack of appetite, muscle weakness, apathy, sometimes even vomiting and diarrhea. It must be remembered that vitamin D is extremely important for our body, for the bone and immune systems, but you should not drink it mindlessly and constantly. I wish you good health.